Hey there YouTube, this is Dr. Greenfun here, and I'm just showing you here my do-it-yourself tattoo removal. Okay? So, basically, I took dried ice. I read about it online that, people have used dried ice to remove tattoos, and I've never seen any videos on it, so I've been wanting to remove this tattoo for some time. And so as you can see, this here, let me see if I can touch it. As you can see, I can touch it and it doesn't hurt. This is 2 weeks into healing time. And this here, this is a scab here. And so I drew over it with the dry ice for a second. And then on the words here, I left it on there for 8 full seconds. And I made sure that the blood returned back to the skin after each time. And I made like a pencil point to get onto the lines there. And I knew it would blister, so that's why I drained it. And I put hydrogen peroxide right on there. And surprisingly, it did not sting. It stings no more than a cut, like a big cut on your finger or something. So far, like I said, this is 2 weeks in, and I can almost guarantee that will be gone. Because over here, the band had continued all the way down, and I'll take some pictures when I can. And that whole scab is, it's like skin, so it's not blood, like a blood scab. So when it gets soft, it kind of flaps a bit, and now it's hardening up because it's no longer soft because from the water. I also put hydrogen peroxide on it for a little bit. I don't use it all the time because it destroys your tissue. I also use iodine, rubbing alcohol 70%, and triple antibiotic. I have been letting it breathe. I changed bandages. I typically wear a bandage a day, sometimes 2. If I'm at work, I wear 3. I had to change them about 3 times. And at nighttime I let it breathe. And, I think it'll be a great success. And it only cost me about $1.19. And also, it stings sometimes. No more than a cut would. The initial treatment wasn't painful. So I'm not going to say do it, because this is on my finger and there's veins, and sometimes it hurts, going like this. But I think, over time, this will be fine. And, this pink area here, I think that with time it'll be back to my normal pigment. And, it's on your hand, so it's a bit thicker of a skin. So I'm not saying to do it anywhere here. There's just a lot of veins and stuff. You're just risking infection big time, I don't recommend doing it on areas where there's lots of, veins and stuff. That's not a good idea. Up here, there are veins and capillaries, so you do have to be aware of that area. For me, I think that I'm lucky that it worked, and possibly that will be the only amount, and maybe I'll show you a video on how to do that, how to do the removal process, depending on how it heals. I feel like a week, this scab should fall off, so we'll see what happens. And all this line here,